New cases of the deadly skin cancer melanoma are on the rise. A new study says the increase in new cases is especially high in older men. Joining us today from Stanford, California is one of the authors of this study, Dr. Tina Clark from Northern California Cancer Center. Dr. Clark, thank you so much for joining us today.
Good morning. Thanks for having me.
Tell us about the study.
So this was a really important study because we used the largest database that we have out there tracking cancer in the U.S. It's called the SEER database. We looked at almost 300 million person years of time to see what was actually happening with melanoma in the U.S. and we had some really important results. We found that rates of melanoma were going up in all the groups that we looked at, different ages, men and women. We also did something that nobody had ever done before, which was to look at different socioeconomic groups. There's been this question that melanoma's rates are just going up because affluent people are going in there and getting screened. We looked at incidence rates for groups of different socioeconomic categories and found that rates were going up in all of them. So that tells us that this is not just an artifact of more screening in affluent populations. It's really a cancer that's going up in all of the groups that we looked at.
Okay, well, some groups had much higher rates than others. Let's talk about that.
Right. So the group that we're really concerned about are white men over age 65. Their rates were going up at almost 5% per year, which means that they'll double in 20 years. Generally, melanoma, like most cancers, risk increases with age, so we definitely see the highest rates in the oldest age groups, but the group that we are really trying to understand why their rates are going up so fast are older men over 65, white men.
Okay, Dr. Clark, I'm just going to throw this out there. It may seem crazy, but are these men outside playing golf? Are they walking? Why is it this group?
You know, there's a lot of other very detailed research going on to understand risk factors for melanoma. Obviously, the sun, having white skin are really important. We're trying to do as much as we can to learn about those kind of risk factors. Some other really important work has to do with immunity, and maybe immune system factors are encouraging these tumors to grow in men. We're not sure, but it's a really important question to help us come up with some advice for prevention.
Dr. Clark, let's talk about geographically speaking. Have you noticed a higher rate in the Sun Belt areas, obviously, as opposed to like the Midwest, or?
Definitely, we see higher rates in the sunnier part of the country. I think our highest rates are here in California, in the south where we get more sun. Mm-hmm. The highest rates in the world are in Australia and New Zealand, where, if you think about it, there's a lot of pale-skinned people who immigrated into a very sunny climate. So we know that there's a correlation between having paler-skinned people living in very sunny climates and high melanoma rates. But again, we're still trying to learn exactly what it is about what type of sun exposure. Is it chronic? Is it intermittent, when like you go on vacation and get really burned just a few times in your life? Is it in adulthood? Is it in childhood? There's just so much to learn about it.
Well, some experts say this marked increase in melanoma signals an epidemic. Can we call this an epidemic?
I don't know. I think that, if something's increasing at 5% per year and doubling every 20 years, can we call that an epidemic? I think if it helps to call it an epidemic, to draw attention, to get people's attention that this is a growing health problem, particularly for older men, then I think we should.
All right, Dr. Tina Clark from the Northern California Cancer Center, thank you so much. Some great information.
Thank you so much for having me.
When you think health, think IRU.